Hi students, and welcome to this mini lecture on cancer diagnostics. There are two learning outcomes that we're going to address for this video. The first one is to look at the common cancers within Australia. So there's 6 that we're going to kind of look at, and just to be aware of the main diagnostic tests/investigations that are used in those cancers. And then we're going to go more generically for cancers in general and just see how cancers can be generally diagnosed and their approach for diagnostic investigation. So in this particular image that we can see here, this is the only image we'll use today. This image, we're going to go through the different approaches for cancer diagnosis, and then up here are the 6 types of cancers that are common, the most common cancers that you see in Australia. So to start with, there's no single test that can be done to diagnose cancer, so there's usually an approach that's done. When we refer to cancer, this is basically referring to tumours or neoplastic growths, and these can be both malignant and benign. So when I use cancer today, I'm referring to either malignant or benign tumours. So commonly cancers will be diagnosed through a series of investigations, and these are going to be these all here. The most sensitive by far is the biopsy, which I'll come to, but I'm going to go through all these examples here and generically how certain results can increase the likelihood of diagnosis or ruling out the possibility of the cancer. So let's start with the family history. So what does that mean? So basically this is any changes in, so I'll put changes in symptoms of the patient. So what's this referring to? So this would be things like weight loss, unexpected or unexplained pain, fatigue, increase frequency of infections. So things like that, just changes in symptoms. Another thing that could be looked at is a positive family history for the cancer. So positive family history, so an example of a history of breast cancer in the family. And then we could also look at risk factors. So what risk factors may increase the likelihood of the individual from getting the cancer? So examples would be smoking, lots of alcohol drinking, sun exposure, etc. Then we go down to the physical examination. So this would be performed by the doctor or the physician, and things could be here: breast examination, rectal examination for prostate, skin checks, lung sounds, so through stethoscope use or testicular investigations as some examples for physical exam. Then we can do some screening approaches. So this could be things like tumour markers. So in some cancers, the tumour itself will release certain antigens or certain cellular markers that can be spread off into the blood. A common one would be PSA, so that's prostate-specific antigen, and that can be picked up in serum levels, and an increased amount of PSA could be suggestive that there's something happening with the prostate. Other screening could be stool screening, and this is commonly done in Australia for individuals over the age of 50. So stool samples can be done, and this could be an indication that bowel cancer could be of question. Full blood counts, so looking at analyses of blood, and that could be indications for changes in the parameters within a blood count, which could be suggestive for not only the blood cancers, but also other cancers in general. Genetic screening, so this would be looking at predispositions for certain cancers. So an example, so I'll put genetic, and an example that would be BRCA, and that is what I'll come back to when we look at the breast cancers. Another example of screening would be urinalyses. Okay, now coming across to imaging. So this is anywhere we're essentially looking into the body from the outside, and there are many different approaches. We could use X-ray radiation, and so this could be through the use of X-rays or CT scans. MRI, which is an approach that is not invasive like the X-rays and CTs, because remember, with the X-rays and CT there's quite a lot of radiation, whereas MRI there isn't. Another non-invasive approach is ultrasounds. We can also use PET scans. Basically what that does is use a radioactive dye that's attached to glucose, and then the individual will consume that glucose, and then the glucose will be taken up by the most active cells in the body. And so this is a test that sometimes is used to look at whether cancer has spread throughout the body. So that would be looking at metastasis, which we call METs. Okay, and then another image that could be used are scopes. So this would be endoscopy, bronchoscopy, colonoscopies, for instance, where you're looking inside the body and viewing that outside. Finally, the most sensitive test, and I will stress that this particular investigation is the most sensitive and essentially would be the definitive reason or the definitive method of diagnosing the cancer. So this is basically where a sample is taken of abnormal tissue and it's sent to pathology to look at that tissue under the microscope usually and to see what those cells could possibly be and if they are cancerous. And so these could be done by different ways. We could do needle biopsies, we could do under scope, so endoscopy. We could be doing it through surgical excision, and that could be an excision, so removing essentially the whole lot of the tumour, or an incision, which is moving parts of it. Okay, so that's all the kind of generic approaches that we could use for cancer investigations to, as I said, to diagnose or rule out the possibility of cancer. But now what I'll do is I'll go to some specific examples from these 6 types. So let's start with bowel cancer. So bowel cancer, let's start with the family history. So family history, there's certain things that I shouldn't say family history, it's just patient history. So essentially bowel cancer is abnormal epithelial growth within the bowel wall. So patient history, certain things, certain symptoms to look for is abdominal discomfort. So that could be pain or just general discomfort within the abdominal region. Changes in bowel habits. So this would be essentially maybe diarrhea or constipation. Just changes in the general bowel habit of the individual, which could also include blood in stool. Okay, and sometimes if the individual develops anemia, so this would be done through a blood test, anemia could be suggestive of chronic blood loss, which can come about through bowel cancer. Next, we go to physical examination. So physical examination is not really so much something could be done in bowel cancer, but we can definitely go into screening. So this could be done through full blood count, and as I spoke about, an example would be anemia. So if the patient has anemia, specifically iron deficiency anemia, that could be suggestive of an ongoing bleed in the bowel, or bowel screening. And so we spoke about that earlier. So individuals over the age of 50 years in Australia are encouraged to complete the bowel screening test, and that essentially would demonstrate that there is some blood in the stool, which should get investigated further. Coming across to imaging, then if there's a suggestion that cancer may be present, a colonoscopy is carried out, and then that could be essentially be used in conjunction with the biopsy to remove parts of questionable tissue, either through an excision or maybe a needle approach. And then maybe if there is suggestion of cancer, a CT or MRI can be done to look for metastasis in further areas than just the bowel, in conjunction with the PET scan. So that's bowel cancer. Let's move on to lung cancer. So over here, lung cancer, first we'll look at patient history. So age is a strong risk factor here. So over the age of 55 would be a risk in conjunction with smoking history. So if an individual was to be over the age of 55 and had a strong smoking history, the physician may look at doing an image of the chest, particularly as a CT scan. Some symptoms that may be suggestive of lung cancer would be a chronic cough. That's generally non-productive. And there could be some blood in sputum if it is productive. and maybe unexplained chest pain. So these are some of the things that may go with the patient history. Physical exam would be looking for lung sounds. As I said, with screening, usually the screening would be, if there's a high risk for the individual, would come across and do a CT scan, which may be suggestive of mass, so masses on the CT scan, or high density spots. So that could be a CT or X-ray, but CTs are usually the recommended imaging type. And then sometimes with the screening, it might be also a sputum analysis. So that would be the patient to produce sputum, and then if there is blood in there, to look for analysis, which is essentially a type of liquid biopsy. Going across to now biopsy, which is the sensitive definitive test, the biopsy could be done under scope, so a bronchoscopy, or through the thoracic cavity. So this is called transthoracic. And that would be a needle biopsy where it's going through the chest, kind of like what we can see here, through the chest into the area of the density, which obviously would be done under imaging, and then that needle retracts with some tissue for investigation. But that would be essentially the way that the cancer would be diagnosed. So that's lung cancer. Let's move on. Now move into prostate. Prostate cancer, let's look at the patient history. So somewhere changes in urination. So these would be harder to initiate urination, a weaker flow, lots of urination at night, so that's nocturia, blood in the urination or blood within the semen, but also pain. So pain in the back or hips is suggestive of cancer because that's the most common location of spread. So pain in those regions could be suggestive of prostate cancer, and that is a differential away from benign prostatic hyperplasia, which is just an enlarged prostate. So that would be suggestive of more prostate cancer opposed to benign prostatic hyperplasia, which is just an enlarged prostate. Physical exam would be a digital rectal examination, so that would be performed by the doctor, and that would be suggestive of an enlarged prostate. Then we could do some screening, as I spoke about earlier, the PSA, which is just an antigen test in the serum. But it's important to note that this PSA levels would be raised with anything going wrong with the prostate. So benign prostatic hyperplasia, which is not cancerous, PSA would also be high, so would an infection to the prostate. So it is questioned how good this particular screening approach is, and in some cases it's not used that readily anymore. Then we come across to essentially biopsying, and biopsying would be done through either MRI or a transrectal ultrasound. So this would be just done, again, probably through a needle biopsy, which would look at the taken parts of the prostate out and then examining that for potential cancer. So that's prostate. Let's move now to breast. So breast, let's first look at the patient history. So we've got something like lumps. So through self-examination, that could be lumps in the breast or the lumps under the armpit, so the axilla, which would be suggestive of lymph nodes. There could be dimpling of the breast tissue or discharge from the nipple. So these are some common symptoms. Risk factors. So the risk factors associated with increased likelihood of breast cancer is age, so over the age of 50, a positive family history, and the patient's reproductive history as well. Physical examination would be a lump, and then the screening could be through a genetic analysis, and that would be positive for the BRCA gene, which would increase the likelihood of the individual developing cancer. But another screening approach is essentially a mammogram, which is an X-ray, and that is essentially looking at the breast. And this is generally done for individuals in Australia over the age of 50. And then if there is suggestion of density or possible tumours in the breast tissue, then biopsies is performed to diagnose. And this could be done through fine needle or a core kind of punch biopsy or a full open biopsy, which would be a surgical approach. And again, the biopsy would be confirming the cancer and the type of cancer. If the cancer is present, we may biopsy the lymph nodes to see if it has spread to the lymph nodes, or maybe a further imaging to see if it's spread elsewhere. Okay, now we move to skin cancer. Skin cancer, going to the patient history, would be a positive family history. So that is a strong risk factor for developing skin cancer. It's important to note with skin cancer, the three main types are melanomas, squamous cell carcinomas or SCCs, and basal cell carcinomas or BCCs. Basal cell is the most benign. Squamous cells can spread, but they generally will remain benign in the early stages. And then the most malignant out of the three is the melanoma. So that's the most aggressive form of cancer, skin cancer, should I say. Other things is sun exposure history, and through self-check, any lesions that are a bit questionable. So the physician then would do a skin check as part of the physical examination. So this should generally be done by a skin specialist, like a dermatologist or a specialised GP, to really be able to do a quality skin check. Screening, there isn't really any screening, so any questionable lesions, I'll put skin check, any questionable lesions would generally go straight to biopsying, and that would be an excision-based biopsy. Could be the whole lesion excised or part of the lesion, and that would indicate the type of cancer. And then regional lymph nodes, like we saw in breast cancer, can be taken to see if the cancer has spread. And then finally, we're left with blood cancers. So blood cancers, two main types are leukemias and lymphomas. So they're both blood cancers, so they originate in the bone marrow, the cells from the bone marrow, and they go outwards. Leukemias stay in the blood, lymphomas usually then migrate to lymph nodes. So what kind of things to be looking out for? Increase in infections. So we know one part of the blood is white blood cells. So if you have ineffective white blood cells, you're more prone to infections. You have bleeding, so bruising. So increased bruises, and that's because you're losing the number of platelets. You could have fatigue. So these would be signs, fatigue, because you've got a decrease in red blood cell, so becoming anemic. Or if you just have lymph node being felt by the individual, so bigger lymph nodes, that's also suggestive of potential symptoms associated with blood cancers. The physical examination probably is really only lymph nodes, but a further investigation would be in the screening for a full blood count, so to look at the parameters, so the white cells, the platelets, the red cells, so that's just purely through number. Then a blood smear would be done to look at the morphology of the blood cells. So you might actually have, say, an increase in white blood cell count, but that's not that sensitive because that would also be increased if you had an infection. But when you do a smear, the morphology of the white blood cells would be different, and that would be suggestive of cancer because their form does change. And also a clotting test could be done. So clotting or coagulation test to look at the function of, say, platelets. And that would be decreased if the blood cancer is involving the platelet cell types. Biopsy is, again, the sensitive test here, and this could be done both at the bone marrow. So that could be a bone marrow aspiration, or it could be a larger bone marrow excision, which takes more amounts of bone marrow, so that would be quite a painful procedure. But also also blood could be a diagnostic form of biopsying by looking at the type of, let's say, white blood cell, which would be indicative of, say, the type of leukemia or lymphoma, and then also the biopsy of the lymph nodes. And there we have it. So that's the 6 common types of cancers in Australia. And so now if we come back to these learning outcomes, hopefully now through these 6 types, you know the common diagnostic investigations used, and then generically speaking, for cancers in general, what are the most common approaches that we use for diagnosing cancer?